So in this lecture, we are going to do the question regarding the coding guidelines, and these coding guidelines questions are asked in the exam. So let us see the weightage of this particular section. So in the 100 marks CPC exam pattern, you will have the coding guidelines, and they are seven for the 7 marks, and you will be tested on the ICD as well as the CPT coding guideline. So let us take first question. How should you code an excision of a lesion when completed with an adjacent tissue transfer or rearrangement? And we have the 4 options, and then the correct answer is the excision is not separately reported with an adjacent tissue transfer or rearrangement of the code. And you will see that this guideline is there in your book, and the excision of a benign lesion or a malignant lesion is not separately reported with the codes of ATT. These are the ATT codes. The next question, when coding for a liver transplantation, what are the 3 distinct components of physician work? And we have the option, and in your book also these 3 steps are written under the liver transplant. So from that, the option B is the correct answer. Cadaver living or the living donor hepatectomy, that is removal of the liver, backbench work, and recipient liver allotransplantation. So these 3 things are the right steps, and that's why answer B is the correct answer. Wound exploration codes include the following service, and we have the option, and let us see what is the correct answer. So here in your book they have given what is the wound exploration. This code describes the surgical exploration and enlargement of the wound, extension of the dissection to determine the penetration, debridement, removal of the foreign body, ligation or coagulation of the minor subcutaneous and muscular blood vessels of the subcutaneous tissue, muscle fascia and the muscles, not requiring a thoracotomy and laparotomy. So exploring including enlargement, debridement, removal of the foreign bodies, minor vessel and ligation. So all that thing comes under here, minor blood vessels. So the D is the correct answer. The full description of the CPT code. So what we do is we directly go to that particular code 24925, and this is the code 24925 in your book, and it talks about the secondary closure or the scar revision, and that is our first option. So A is the correct choice. Which of the following codes allow the use of modifier 51? And we have the code 20975, 93600, 35600, 45392. So what we will do is we will go directly to the the appendix, which talks about the summary of the medical code exempt from modifier 51, and in that you will see that 20975 it comes, then 93600 it comes, and 35600 it comes. So the only code on which I can write 45 following codes allowed. So the only code I can use is 45392 because it is not there in that list. Category 3 codes are temporary codes for emerging technology, services and procedures. If a category 3 code exists, it should be used instead of an unlisted procedure code in category 1. Example of an unlisted category code is 60699, whether it is true or false. So we have this definition of the category 3 code. Following section contain a set of temporary code for an emerging technology, services, procedure and service paradigm. Category 3 codes allow the data collection. Use of unlisted code does not offer the opportunity for the collection of the specific data. If category 3 code is available, this code must be reported instead of category 1 unlisted code. And That's why our answer is A, because that's what they have written. How is proton beam treatment delivery defined? Now, many a time what happens is to find out the exact CPT coding guideline, we get confused. So always take the help, you should take the help of index. So you can go into the index under the proton beam delivery, you will find the code. So you pick up that code and go to that particular chapter, and then we can see that proton beam treatment delivery defined by simple, which is here simple, then intermediate and complex. Simple, complex and compound is not the correct answer. So the correct answer will be B, because it talks about simple, complex and intermediate, and these three things are there. There is a simple, there is a intermediate and there is a complex. Now, this is the medical coding guideline for the ICD. So, how are the diagnosis sequence when coding for the multiple fracture? And we have the guideline that whenever we are coding for the multiple fracture, the sequence is accordance with the severity of the fracture. So, it is not a anatomical location, neither it is the longest bone, but it is the severity. So, taking into consideration, you will see that answer B is correct. The following statement does not apply to what codes? These codes are never standalone codes and never primary codes. So that is mainly the add-on code, because whenever we are writing the add-on code, we have to write the primary code first, and we never write add-on code as a single code. There will always be the primary code prior to that, and that's why answer B is the correct answer. That is the add-on code. When using the CPT index to locate procedure, which of the following are considered primary classes for main entries? So here you will see at the beginning of the book, they have given the definition of the alphabetical index, and in the alphabetical index they have said this code book features an expanded alphabetical index that include listing by procedure and anatomical site. Procedures and services commonly known by their eponyms or other designation are also included. So in between all these things, the correct answer is A, because it is a procedure or a service, organ or another anatomic site, condition, synonym, eponym and abbreviation. So the first A is the correct answer. How would you report a case of a patient with a non-healing burn? Acute burn, chronic burn, third degree burn and traumatic burn. Again, this is a ICD guideline, and here it is very clearly given that non-healing burns are coded as acute burns. So our answer A is the correct answer. Cynthia is a 28-year-old pregnant. She present to the emergency room complaining of the diarrhea with watery bowel movement, with incontinence, cramps, nausea and vomiting for the past 12 hours. She is unable to keep anything down, including liquids. She has been eating healthy diet and does not feel this problem is based on something she ate. After testing, she was found to have enteritis due to Clostridium difficile. She was admitted to the hydration and for the further treatment. In what order should you report the diagnosis code for the Cynthia's condition? And we have all the codes here. And there is a guideline that obstetric cases required codes from the chapter 15. Codes in the range they have given the pregnancy, childbirth and puerperium. Chapter 15 codes have a sequencing priority over the codes from the other chapter. Additional code from the other chapter may be used in conjunction with the chapter 15 code to further specify the condition. Should the provider document that the pregnancy is incidental in encounter? So you have all this option, and by looking at the option you will see that the first is complication of the pregnancy, childbirth and puerperium. Here it is a chapter 15. Code should be written first, followed by the infection and parasitic codes. If the type of a diabetes mellitus is not documented in the medical record, what is the default type you should assign? And we have been given 4 option, and there is a guideline that if the type of the diabetes mellitus is not documented in the medical record, the default is eat well, that is a type 2 diabetes mellitus. So our answer will be D. Which services is not included with the anesthesia service? And we have this guideline in our book in the anesthesia general guideline. Unusual form of monitoring, example intraarterial, central venous and Swan-Ganz are not included. So our answer is A. How does the CPT professional edition define an emergency department? And where will you find this answer? So you will go to the ENM section. In the ENM section, they have given the code for the ER. And at the beginning of the ER codes, there is a definition of the what is the emergency department. It is either called as a ED or ER, but it says that the emergency department is defined as an organized hospital-based facility for the provision of the unscheduled episodic services to the patient who present for the immediate medical attention. The facility must be available. So in this case, it is a hospital base. So if you have seen all the options, they are very close. This is hospital base. This is also hospital base. So you have to, now here they have used the word schedule, but we have the word unscheduled. So this is unscheduled. Unscheduled service to the patient who present to the medical attention. Here it is an organized hospital-based facility for the care treatment, and here it is organized outpatient-based facility for the care treatment. So after looking at all the options, the correct option is option A. How is a neuroplasty procedure described in a CPT professional edition? Now, how do we find out this answer? So first of all, whenever you get a question like this, you have the word neuroplasty. Pick up that, go into the index and check out what is the code. You pick up that code and come to that particular section. And just about that code, there is a definition of this neuroplasty. It is a surgical decompression or freeing of the intact nerve from scar tissue, including external neurolysis and or transposition to repair or restore the nerve. So if you see the surgical repair of the nerve using only microscopic technique, that's not correct. Position of the nerve is not. So here these are two, decompression. So we will eliminate the wrong words and we'll choose the right answer. Here everything is same except in A you have the intact nerve and here you have the intact vein, and neuro is a nerve, so A is the correct answer. So you will eliminate like this, and I told you how to look out for that particular exact definition. So in the exam also, when you get this question, do not panic, immediately go to the index, check that procedure, see the code in front of that, and you will definitely see the definition just above that code. Which of the following is true regarding ICD-10 codes with the word indices classified elsewhere in their description? Now we will see they can never be the first listed code. So let us see what is the definition. The codes with this title indices classified elsewhere, code with this title are the component of the etiology manifestation convention. The code title indicate that it is a manifestation code. In disease classified elsewhere, codes are never permitted to be used as a first listed or the principal diagnosis code. They must be used in conjunction with underlying condition code, and they must be listed following the underlying condition. So they can never be the first listed code. They should always be, they are unspecified and none of the above. So after reading this definition, you can very well say that A is the correct answer, because they can never be first listed code because they are the manifestation code. Which of the following statement is true regarding sequencing of the E code? Now, here you have to be extremely careful with the wording, because the wordings are very close and you have to choose the exact option. So, external cause codes, E codes for place of occurrence takes priority over all other E codes for medical history take priority over all other E codes. E code identifying the screening exam as the reason for the encounter, and E code for the transport accident takes priority over all other E code except the cataclysmic event under child and adult abuse and terrorism. External cause code for the transport accident take priority over all other external cause code except the cataclysmic events, child and adult abuse and terrorism. So you will zero down the answer D. And when you will do all this kind of question, your guidelines will be perfect, or you will know where to look for those guidelines quickly. Which statement is true about the V codes? V codes are never reported as a primary code. V codes are only reported with injury code. V codes may be used either as a primary code or a secondary code. V codes do not have to correspond with a procedure code. The external cause of morbidity code should never be sequenced as the first listed or the principal diagnosis. So we have the answer: V codes are never reported as a primary code. That is because never listed as the first listed or the principal diagnosis. Okay. When does the anesthesia time begin? After the induction of the anesthesia is complete, during the preoperative exam prior to entering the OR, when anesthesiologists begin preparing the patient for the induction of the anesthesia, and was the supervising physician signs over the patient care to the anesthesiologist. It is the beginning. Okay, when does the anesthesia time begin? And here you have the thing: anesthesia time begins when the anesthesiologist begin to prepare the patient for the induction of the anesthesia. So we have the answer: when the anesthesiologist begin preparing the patient for the induction of the anesthesia. So our answer C is correct, and this guideline is given in your chapter specific guideline. It is at the beginning of the anesthesia chapter. The size of an excision of a benign lesion is determined by. Okay, now we will see, this is a guideline which is very clearly given. Code selection is determined by the measuring of the greatest clinical diameter of the apparent lesion plus that margin required for the complete excision. And in the bracket they have written lesion diameter plus the most narrow margin required equal the excision diameter. So adding together the lesion diameter and the widest margin, is that the thing? No, adding together the lesion diameter and the narrowest margin necessary to adequately excise the lesion. The diameter of the lesion only in the depth of the lesion. So the correct answer is answer B, because we have the guideline here: the lesion diameter plus the most narrow margins required equals the excised diameter. Simple single layered laceration require extensive cleaning due to being heavily contaminated. The code selected would come from the code range 12031 to 12057. If you see this code range, it is the intermediate repair. So the wound is simple repair. So we still coding it to intermediate repair. Why? Because there is a guideline, and this guideline you will see into the intermediate repair, that single layer closure of a heavily contaminated wound that have required extensive cleaning or the removal of a particular matter also constitute the intermediate repair. And so A is the correct answer. A scapulopexy is found under what heading? Now, whenever this kind of medical terminology or this kind of question comes, when you don't know where to look for, go to the index. Under the S series, you will find out the word scapulopexy, find out the medical code in front of that, and you go to that particular section, and in that you will have all the clues. So here the scapuloplexy, and it comes under repair, revision and reconstruction. So your answer D is the correct answer. I'll be doing roughly 5 parts in this coding guidelines question and answer, because you get 7 questions, and this way when you do more and more questions, your guideline will be better, or at least you will know where to look for them.